We have to be more careful with how we are prescribing antibiotics. Patient yesterday went to the doctor. They did some blood work, couldn't find anything wrong. They were feeling bad. They didn't come to our office and went to the primary care doctor. They were feeling bad, did some blood work, said, "We can't tell what's wrong with you. Here's an antibiotic." Look, this is not good antibiotic stewardship, as we call it, all right? This is the type of thing that creates antibiotic resistance and superbugs and things like this. And we do some very specialized wound care, and we see so many people that are resistant to antibiotics. So many people because they've just been prescribed them without any proper due diligence on what is actually wrong with the patient. The doctors don't culture for the infection to find out what they're actually prescribing for. But it's also the patient's fault. I want to let you know, maybe it's you, I don't know. You expect when you go to the doctor, they're going to write you a prescription for something. You go to the doctor and you say, "I need an antibiotic," because you think that's what handled it before. Oftentimes you go to the doctor, nurses are going to love this. You go to the doctor, you felt bad for a couple of days, you sort of demand that the doctor writes you a prescription for an antibiotic, and then because you feel better, you think the antibiotic did it, when in all reality, more often than not, you were already on the downhill, or the uphill, if you will, and your body was already starting to handle whatever infection you had in the first place. And usually it's viral anyway, which antibiotics don't work for. So antibiotics don't work for viral infections. Most of the time, you're feeling better because your body is handling on its own. The doctor would have been better off prescribing you a sugar pill. Anyway, look, the doctors are at fault for the antibiotic resistant, but patients are too. Stop going to the doctor and demand an antibiotic every time you feel bad, all right? Stop doing it for your kids. You're setting them up for poor gut health, poor gut microbiome, poor skin health, allergies, all kinds of things, all right? We have to get away from using an antibiotic every time you feel bad. And especially if you're going to go to the doctor and they don't even know what type of bacteria, if they even suspect that you have a bacterial infection, and they don't culture to find out what that infection actually is, meaning what bacteria is causing it, you could be taking an antibiotic that doesn't do a thing for what you have going on. Just stop doing this, all right? This is what I'm speaking on the behalf of doctors. Doctors don't want to hear it either, meaning they don't want people coming in demanding an antibiotic. The nurses definitely hate this, but the doctors have come conditioned to do this because the patients demand it. Everybody's at fault on this. And I'm Dr. Dave Morris from Magnolia Medical Center here in Murfreesboro, Tennessee. We do root cause functional medicine. Our goal is to get people well without the use of drugs and surgery. We're really darn good at it. And that's our mission. That's what we love to do. Hope you found this helpful. Take care today.